Maternal mortality is rising at an alarming rate in Texas, and at the Texas Tribune we found a few of those reasons why include prenatal care, or lack thereof, access to postpartum care, a number of changes to the Women's Health Program in recent years, and the way that we collect data and count data for maternal deaths. In 2016, two different reports came out looking at maternal mortality. One from the State Task Force on Maternal Mortality and Morbidity, and another one in a medical journal. Both found that there's been a significant rise in the number of women dying after childbirth. And so at the Texas Tribune, we decided to look at why that is and what are the systemic reasons behind that. Many people point to the 2011 budget cuts for family planning services when the state decided to cut $73.6 million from the family planning budget. Most people seem to think that that's part of the reason why the number of women dying after childbirth has been on the rise, but it's a bit more complicated than that. So one of the big factors is that Texas has not expanded Medicaid. By not expanding Medicaid, advocates have simply said that we've squandered opportunities to give more women access to care. So you have women who do not have access to health insurance, didn't intend to get pregnant. Some women are missing out on their prenatal care. So they're actually going into their pregnancies with all of these chronic health issues that haven't really been addressed. And that's a big problem because doctors don't know how to prepare for complications if they don't know what women are up against within their bodies. When we're thinking about how maternal deaths are counted, the data is really, really complicated. The Texas Department of State Health Services is working on their own methodology, and the Centers for Disease Control and Prevention has their own way of counting it. On top of that, we have a check mark on death certificates for if a woman was recently pregnant before she died. That can also complicate things too, because if someone's mischecking the box, that means that we could be overcounting or even undercounting the number of maternal deaths in Texas. Maternal mortality is a complicated issue, but with more research and conversations, Texans are better understanding what it means and how to prevent it. For more information, go to texastribune.org.